Hello, Dr. Cornelie, can you hear me?
Yes, hello. Can you hear me?
Yes, we can hear you perfectly fine.
Okay. Thank you very much for having me here. And from a cold Holland, I want to congratulate you on this beautiful congress, and I want to express my warmest feelings to the Jan and the organization, and you do a wonderful job. I'm going to try to start my screen, share my screen. And I hope you are seeing my screen now. I am Cornelie Westermann. I'm I'm an equine internal medicine doctor in Utrecht University. And I'm also a director of education for our students in Utrecht. And today I want to speak a little bit about welfare in our patient care, teaching and research at the Faculty of Veterinary Medicine in Utrecht University. If I go to the next. First of all, as I said, the congratulations to you and thank you very much. I can hear I can hear somebody talking through me, but what? Okay. In our patient care and clinical teaching in Utrecht, we have very many rules. I think you have about the same system as we have, and veterinary medicine. We have a lot of theory, and then we have a lot of clinical work where students come in the clinic and treat patients. And what we have as a welfare in our patient care is very specific. We have an ethical and welfare committee, and everything we do with animals, our own animals, or test animals, or teaching animals, are very strictly with the rules. Like if we have an anemic patient who needs blood, we have strict rules for blood donors that they can only donate twice a year. We have strict rules about teaching horses who can only be used once a month, etc. And we have lots of rules to keep our animals in as much in happy state as possible. So we have big stables, and they need to be in groups, and they need to be outside a lot of time. So that's all meant to reduce the use of laboratory and education animals. Because if you see how many animals are used worldwide to educate veterinarians, I think it's really much, and it's how many animals are used to to be in laboratories to give us a nice perfume or whatever. It's really a lot. So that's about the reason why there are so many rules, and I think that's good. The only thing is we need to expose the students to teaching animals so they don't try things at the patients first. But at this figure you can see in it's one of our skills labs where the students always try things first at model animals, so they don't use patients the first time, and they don't use education animals. Well, our study in Holland is 3 years of bachelor and 3 years of master, and we have a lot of welfare in the education. In the first years, in all the years, there's always a line of veterinary professional. And in this line of veterinary professional, students learn how to become a good veterinary professional, and they learn to reflect on their action, and they learn to get confidence, but also they learn a lot about ethics in veterinary medicine and in welfare. In our master, we have a welfare track. If the students they can choose it, and they have courses on adaptation and welfare. Here you can see our bachelor, the first 3 years, and all these things that are surrounded are about the line of veterinary professional. So every course has a line where they can talk about things like welfare. This is our master, year 1, year 2, and year 3, and this is all through the master, there's this line of veterinary professional again. And if you go to the profiling part, now this is the first year they get at least a week welfare assessments and risk analysis. So they go to farms or they go to children farms, and they analyze the welfare being of those animals. And in the profiling courses, you can see that there are some, if students want, they can choose even 25 weeks of welfare tracks, but that's not obligatory. That's for students who like to do that. So we have a lot of welfare in our teaching. And if you look at our research in Holland, of course, it's very different than Jakarta. And well, the weather now is so different that I wish I was in Jakarta right now. But we have welfare in research, and we have, of course, research purely about welfare. And that's Vivian Gerlich, my colleague, has talked about that to you. But today I want to talk a little bit about how we have research that improves welfare as well. And it's a broad subject, of course. So I chose for two subjects. One of the research is that I did myself is about the air quality of horses and human and many species who share the same asthmatic problems. And I'll talk to you a little bit about the wear-fall of the horse in the pain scale. This is the first research, and we've tried to improve the respiratory health for horses and humans in a horse stable environment. And we used the effects of the nebulizing device on dust. And dust is a big risk for welfare, for humans, for animals, for horses, for everybody, really. And dust is, airborne dust is the worst. That airborne dust affects the working and living in horse stables, but also in every environment. For horses, it's a big problem because horses in stables, as you can see on the picture, are often in very dusty environments, and horses suffer from equine asthma a lot. And we have found out that the equine asthma looks a lot like the human asthma, and it's really kept in place due to all these airborne dust. So dust management regime is very important. Well, what kind of dust is important? We have several sizes of dust, and you have the inhalable dust, which is big dust particles that stay in your nose. You have particles that are smaller, are going more deeper to the thorax. That's 10 micron. If they're even smaller, they are respirable, 4 micron. And if they're very small, they can go very deep into your lungs. So the penetration is important, and we are interested for asthma and for the fine dust. We are interested in the small fractions of dust, so the respirable and the high risk respirable fractions. Our research question was, how can the mass concentration of high risk respirable dust particles be lowered in horse stables? And we did this research, of course, in horses, but I think it's important, and it has been performed in humans as well. And we are performing a lot of dust measurements in our city and in environments as well. And I think it's even interesting for Jakarta, and maybe we can collaborate on this one, because in Jakarta, all animals that live there, but all humans as well, they it's interesting how it works with dust. Well, in the stables, we can easily try to do something about it, of course. And we had 3 tests of it. We tested a nebulizing device that gives mini droplets, which will take the dust down to the floor. And we tested the ionizing device, and the ion differences will attract dust to the device. And we tested the influence of dust-free beddings and roughage. We tested it like this. On the left, you see 6 stables in one unit, and we had 4 of these identical stables. So we could give them dust free environment, we could give them a lot of dust like straw and hay. On the picture, you see a dust-free environment with shavings, and they don't get hay, they get dust-free haylage. You can see the nebulizer giving those mini droplets, and here you see the pump. We had, and this is more interesting for you maybe, we had dust filters, and we put them basically everywhere, and we had filters for every different size of the dust. So they were hanging around in the stables, but they were also fixed on the horses. They were fixed on near the nose, and they were fixed on the back of the horses. And so we had many locations of the sampling. We also checked the humidity, the temperature, and the ammonia in the stable, so we could state if there were any changes. Well, I skip for you. I can talk for hours for this one, but I go straight to the conclusion. And we tested those machines, and the nebulizing device did not reduce the dust. We did expect it, but it did not. So people do it a lot in stables, but it didn't work for us. The ionizing device did not improve the dust, but the dust-free bedding and roughage, so the management, really improved the amount of dust. So it reduced the dust. So we learned that if we keep horses on dust-free bedding instead of straw, and we give them dust-free haylage instead of hay, we really improve the health of the respiratory system. And if you compare this to humans or to other animals, if you improve the management in the house, you really improve respiratory welfare, I call it. This other thing is about pain assessment in horses and donkeys. And I think it's really important that we all learn to read our animals, that we try to know when they're in pain and when they're uncomfortable. And it's my colleague Thijs van Loon. He chaired this research, and he has done it for years, and ending up in a welfare app and a welfare training. And there are many ways to measure pain in horses, but the two that we used were the composite pain scale and the facial expression. I'll show to you. If you see about what is composite pain scale, it's really reading the horse and seeing every detail of it, what's happening. Of course, this is a very painful horse, and so it's a good example, and we don't wish horses to be this painful. But what you can see is that there is a strange body posture. If you palpate this horse, he is really painful. You can see he's unloading a limb, which is painful. His respiratory, breathing and heart frequency were very high, and he has bad responsiveness to action. This is the facial pain scale, and you can see on this face that the horse is painful, and you can see the position of the ears. The ears have gone to the back. The eyelids have dropped. The corners of the mouth are like in a grimace. The horse has bad responsiveness, and his nostrils are really tense. It's not only horses that have facial expressions of pain. You can see in all species, you can read the animals, and you can assess their amount of pain. Here you can see examples of a human, rabbit, a rat, and not a rat, and a horse. But here there are many more examples, and I think it's very important that if we talk about the welfare, that we really try to make it objective how the welfare is going. And even in cows, in piglets, in rabbits, in mouses, and in horses, and in ferrets, and in sheep, everywhere, all species have been scaled and have scoring of the amount of pain. So what we tried in Holland to do is try to put a scoring on the facial expression of pain. and we had 9 criteria. You can read here: the head, the focus of the horse, the lips, the ears, flaming or yawning, grinding with the teeth, moaning, how the position of the eyelids is, the nostrils, and the muscular tone. If everything was perfect, the score is 0. If everything was bad, the score was 18. And we tested it on many different areas of pain. We monitored the visceral pain with colic horses with the scale. We monitored it for head-related pain, like if you have eye problems, and we monitored with orthopedic surgery. We checked it with and without which analgesia, so which painkiller would be the best, and we could really read it out with the pain scales. And we also use it for foals. The little foals who are ill, they are not really easy to read if they are in pain or not. So we made also objective pain scale for the ill foals, and it turned out to be very clear if you use this objective assessment. So what about donkeys? We also discovered that it's possible to have objective assessment of chronic pain in donkeys. So there is a chronic pain scale of donkeys, and it's a really complicated scale because donkeys are really complicated to show their pain. So it's combined with the composite pain scale with the behavior, the movement, the body composite score, and the posture, and the facial expressions are in it as well. And if you see, it's a really big pain scale, so it takes some time to do, but if you read it, it's really interested what's all in it. And this is just one of those things about the muscles. If they have good muscles, symmetric with no muscle loss, there's a 0, and if they have muscle loss, it gets to the score of 3. And in the end, you can, if everything is wrong with the donkey, you have a score of 48. Well, it's not just theory, it's also used in practice. And this is another part of the scale about the eyelids is one of those things. And if the eyelids are opened, it's good. And if they're tightened, or if they're squeezing their eyes, you get a score. So the facial expression pain scale gives a score of until 24. And together you can use them in practice. This is one example. We had this George, who was a 28-year-old donkey, and he was just a little bit limp, painful on his feet, and he was a little bit slower than the rest. And when he got a big painkiller, equipalazone, and when we objectively scored him with the pain scales, he had a pain scale of his face, which with a score of 6. And he had a pain scale of the composite pain scale of 15. And whatever we did with more analgesia, it didn't change his pain scale. And if you have together a score of 21, it's just too high. It's not welfare friendly. So we chose, and that in Holland it's easier, I know, but we chose for euthanasia because he had a really bad life and he had always pain, always pain. So how can we really use it in practice? And it might be interesting for Indonesia as well. We have developed an equine pain and welfare app, and it's for horses, and it's for donkeys and for foals. And this app does pain measurement, and I just have one page of it. You fill in which horse or donkey it is, and you can choose who you want to score and with what system you want to score it. And this is just one part of it. You can touch one of the things you are going to do, like looking at the abdomen or how his tail is doing, and then you fill it in and you score the movements for 5 minutes. And you can see what he is doing. Is he standing quietly? Is he rolling, etc., etc. So you just fill in this app, and in the end, it rolls out what kind of score, pain score there is. This is about the faces. Does he have normal ears, or are they down? Are the eyelids opened, etc. So you can score him during days or during weeks or during hours or whatever you want. And so you get the objective measurement. You can also let owners score the horses and or the donkeys. So and then you have something to train them. This is the site where you can train them or train yourself, and that's an international free site, and you can really train how to look at horses and donkeys and how to objectively measure their welfare state. This is one part of the instruction phase. You can score a lot of photos, and you can train yourself, and you get feedback on it, which picture is which picture is has a score or has no score. So this is a really small, quick overview of what I am doing and what we are doing in Utrecht. And I think if anybody is interested, we could always collaborate or help each other. And so here's my email address for if anybody is interested. So thank you very much for your attention. If there are questions, I'll be happy to take them.
Thank you so much, Doctor, for the very insightful and comprehensive presentation. It's very interesting that there are a lot of rules and regulations and even new research on how we can do animal welfare, even to their health. So right now, I will open the session for any discussions, if there are any, perhaps from veterinarians or veterinarians graduates. You can ask directly to the doctor. Oh, there's one. Okay. Could you please state your name and where you're from? Thank you so much.
Okay. Hi, Dr. Cornelie. Hello, my name is Mary. I'm from Jan. Thank you for being here. I have some questions that about your presentation about expressions or pain expressions of the horse. So you mentioned one of that about like the pain expressions like moaning or yawning. So I would like to ask about how do you justify that, or every like a yawning, yawning or moaning expression from the horse is exactly pain expressions, or is there like there is scoring or specific justification to say that this is like the pain expression, this is a pain expression, this is not like a relaxed expressions. Thank you.
Thank you. Nice to see you live. I've heard a lot about you, Dr. Mary. Luce is really happy with you, I heard. And it's a really good question, because in human people, yawning is also a sign of relaxation. And with even if you have stop sporting people, if they yawn, then they're well prepared and relaxed. There are some horses that have yawning as a relaxation, and some horses, for some horses, it's a sign of pain, and it's a sign of even stomach ulcers. And I think it's important to observe, to ask the owners or ask the keepers if the yawning is new or if it's normal for this animal. If some animals do it as a habit and some animals do it as a pain. So I think the frequency of yawning and the changes of yawning during the time are very important. If you have, and it's only one element of the total, so it's never a single sign of pain. If other things like teeth grinding, that's always pain. That's never a habit or something. But the yawning is a good one. That there are a few animals who do that as a relaxation, but it could be pain as well. So you have to know the animal and see if there are changes in it.
I think that's pretty much answers the question. Doc Mary, do you have any further questions? Okay, then, due to the limited time we have with Dr. Cornelie, I have to close the discussion session. So again, thank you so much, Dr. Cornelie, for giving me your spare time in your very busy schedule. I hope we can see you and have discussions more with you soon. Thank you so much.
Would be happy. Thank you.